Today we are starting about in the second lesson growth and development in the child. The most important thing is the breastfeeding. The breastfeeding is important. The breastfeeding is a wholesome food for a baby. It is one of the wholesome food for a baby. What the breastfeeding is breast milk can contain all the nutrients which are needed by the baby during the first 6 months of a life. The 6 month is called as exclusive breastfeeding for a 6 month. Next one is the benefits of there is a benefits of mothers and benefits of mother and benefit of children, infant. What are the benefit of children? What are the benefit for a infant when during the breastfeeding? The rich in sugar, lactose. When the breast milk is contain the rich in sugar, lactose, and IgA provide immunity to the newborn and protect from the different type of infection. It is having a immunity power. It can depress and provide immunity to the other different infections. It is contain the PABA. PABA means para-aminobenzoic acid, protect the baby from the malaria. It will protect the baby from the occurring the malaria. It contains the amino acid like taurine, which are important as a neurotransmitter. Neurotransmitter is important to develop the brain. These are the infant benefits the breastfeeding. Next topic is what are the benefits of mothers. Well, during the breastfeeding, mothers can having the benefits. What are those? It lowers the risk of ovarian and breast cancer. It is decreased and lowers the occurring of a breast cancer and ovarian cancer for the mother. Help the mother to lose extra weight gain during the pregnancy. During a pregnancy, mother weight will be increases. To reduce the weight, it is the benefit for a breastfeeding. It is one of the important to lose the weight for a mother. Reduce the PPH, postpartum hemorrhage. It is also one of the important risk for a mother. The promote emotional bonding between a baby and mother. It is the main important thing when we are doing the breastfeeding. It is emotional bonding between the baby and mother. It can promote. Next one is the types of breast milk. The types of breast milk, there is a 5. First one is colostrum, transitional milk, mature milk, fore milk, and hind milk. First one is a colostrum. Colostrum, as well, you know that yellow, thick, and milk secreted during the first 3 days of delivery. It is secreted the first 3 days of delivery. It is like yellow and thick milk secreted, and it contains the antibodies IgA. It is one of the important colostrum. Important type of milk. It is a colostrum. Next one is transitional milk. Transitional milk is secreted during the 4 to 15 days of a delivery. What is contained? It contains the high fat and the sugar content. Third one is mature milk. Mature milk is a thin, watery milk secreted after the transition. The mature milk is after the transition milk. It can after the secretion of a transition milk, it will be secreted. For fore milk is available at the starting of a feeding. In the starting month we are feeding, it is called as a fore milk. Hind milk is the milk which is available at the end of the regular feeding. It is called a hind milk. Also, physiology of a lactation. How the lactation is physiologically function. The first one is the sucking of a nipple by the baby. When the baby is sucked by the nipple, there is the stimulation of hypothalamus. When the stimulation of hypothalamus occurs, the release of a prolactin into the blood by anterior pituitary gland. When the stimulation is occurring and the releasing of a prolactin is a milk. It releases into the blood by the anterior pituitary. When the milk is secreted, milk is releases. Milk secreted by the alveolar epithelial cells by a breast. How milk is secreted by the alveolar. When the milk is secreted, milk is secretion, production of the milk. Next one is the types. Breastfeeding position. Next one is the position during the breastfeeding. These are the important for the mother as well as the child. First one is the cradle hold position. We can see in the pics, which should be clarify your cradle holder. Cradle hold position. It is the most common position. Infant head is supported in the elbow. The back and buttocks is supported by the arm. Elbow is supported by the head. Mother's elbow is infant's head, and buttocks and back are supported by the arm and lift to the breast. These are the cradle hold. Next one is a football hold. Football hold position. It is like a football. How we hold the football. That like the position should be there in the mother. The place baby placed under the arm like a holding football. It is how the baby placed under the arm like a holding a football. And many mothers are not comfortable with this position. The football position is some many mothers not comfortable with this position. Third one is slide position, slide lying position. It is we can see in a picture. We can show them in the picture. The mother lies on her side, propping up her head and shoulder with a pillow. The mother should also having the rest during the breastfeeding. It is important for the breastfeeding, important for the mother and the child. Next one is a cross cradle hold. Cross cradle hold. It is the baby's trunk and head are supported with the forearm and palm. It is one of the important position during the breastfeeding. These are the importance during the breastfeeding. These are important. First one you can see in the breastfeeding. What is breastfeeding? What are the benefits of breastfeeding for infants and mother? Next one we can talk about the types of breast milk and the physiology of breast milk. Next one is a position. Thank you.